Foremost, I would request everybody in this hall to sit back, ease yourselves, and close your eyes for 10 seconds. It's a distinguished honor to be here. Thanks very much. Since last 11 months, I have been finding an intersection at music and medicine and have been advocating about instrumental music therapy, especially in palliative medicine and palliative oncology in India and the United States. Music therapy research is heterogeneous and expanding. Our understanding about the neuropsychoendocrinology and immunology of music is ever evolving. I would highlight 4 key focus areas: neurobiology, music therapy, clinical trials, and interventions. In 2005, music therapist and professor Dr. Thomas Hillick and colleagues assumed 5 factors which contribute to the effects of music therapy. First one is attention. So music provides as a distracting factor from the negative emotions such as pain, sadness, anxiety, worry. Second one is emotions. So music can modulate the activity of all major limbic and paralimbic brain structures involved in the initiation, generation, maintenance, termination, and modulation of emotions. And this particular effect is made use in managing depression, pathologic anxiety, and post-traumatic stress disorder. And these disorders are partly related to the dysfunction of limbic structures such as amygdala and paralimbic structures such as orbitofrontal cortex. Third one is cognition. So that is related with the memory processing. So when you listen to a music, how you comprehend it, how you decode the music, lyrics, tunes, and that is made use in Alzheimer's patients. Fourth one is behavior. The evocation and conditioning of behavior when you listen to music, the way you walk, speak, grasp. Fifth one is communication, which is made use in selective mutism. So active music therapy in which patients make music can be used to train skills for non-verbal communication. This is interesting. This is the first study on the modulation of amygdala activity with music and correlating it with the cerebral blood flow. Two key points from this particular study. Music can induce real emotions because the activity of core structures of emotion processing was modulated by music. Second one is the empirical basis for music therapeutic approaches for the treatment of affective disorders. Why is this study significant in Indian classical music? From the personal experience evidences and from the musical grammar we are taught in the musical academics, music colleges, etc., and also from our own gurus or mentors, we know that the concept of ragas, be it in North Indian, Carnatic, Hindustani, or in Carnatic, South Indian classical music, the ragas can evoke a particular sentiment. So I will introduce about ragas. So ragas are nothing but a particular ascending and descending pattern of notes, which in Western music, if you want an analogous, it is not a tune. Raga is not a tune. Raga is a scale. Now, the raga which I started with, which is Shuddh Sarang, that evokes the sentiment of romance, and A rag like Kalyani can evoke joy. A rag like Pantwarali can make you cry. So now I'll play a piece which is set in rag Bihar. It's Carnatic Bihar, which is supposed to evoke the feeling of joy. It is usually played at weddings and auspicious occasions. Music therapy has been used in neurological rehabilitation, epilepsy, stroke, brain injury, dementia, depression, and other cognitive disorders. It's as well used in acute pain, end-of-life care, and not only in patients but also in their family. 6 interventions of music therapy. Music listening. Second one is verbal and cognitive participations, which means that songwriting. The patient is asked to write songs, and vocal participation is obviously singing and humming. Physical participation is when the patient plays an instrument or does tapping with the feet or clapping. Verbal or emotional participation is when a music is given, how the patient is relating it with the memories and how he understands and reviews the lyrics. And music-assisted relaxation. There are 2 types of music therapy. Clinical and therapeutic. So according to American Music Therapy Association, AMTA, clinical music therapy has to be done by a professional board-certified music therapist. So in our case in India, unfortunately, Medical Council of India has not given any recognitions or any kind of board certification, or we do not have a central government or a government music therapy education or a music therapy course. But yes, so AMTA says that clinical music therapy is patient-preferred music, whatever the patient prefers, vocal or instrumental, depending on that. And it's evidence-based. If there is a randomized control trial saying that there is an evidence with this kind of music, then they will give that particular music. And it has a clear educational goal. Second one is therapeutic music therapy. This we would have seen, like bedside patient, if a musician is singing or playing an instrument, that is therapeutic music therapy. At the reception or ORs or infusion centers when music is played, that's therapeutic music therapy. There are plenty of randomized control trials conducted at the leading cancer programs. I'm just quickly leafing through a few of them. 2006, with 25 patients, outcome is that music supports anxiety management in terminally ill. In 2015, 84 patients. Advantage is that low dropout rate. Outcome, significant reduction in fatigue score. In 2016, 84 patients, reduction of vascular sympathetic tone, pulse rate and blood pressure came down. In 2019, 57 patients and 53 family members. Music facilitated stress relief, pain relief, relaxation, support in terms of spiritual and emotional needs, general feeling of wellness. When I was a visiting medical student at Harvard and Stanford, at 7:30 a.m. when I entered all these cancer centers, I listened to this soothing cello or a piano music, classical music. And even at the rush hours at 12, like there will be a lot of patients, there will be a lot of cacophony, but in a very low tone. The ambience of the entire reception is kept down with the music, and it's really calm. Second one is a picture from a regional cancer center in India. We can certainly never compare our healthcare system with anybody else. We do have a huge number of patient load. And if we can use that as a plus point and take that into a positive stride, and creating randomized control trial with a large number of cohort, we can create significant and impactful and statistically significant evidence with Indian classical, vocal, or instrumental therapy. Just statistics, one regional cancer center in India will have, like in 1 year, over 6,000 patients. One day outpatient, 1,000 patients. There are 24 regional cancer centers. There are several other cancer centers, private, public. There are so many NGOs, palliative centers. All these institutions has so many people, so many people who are in pain, anxiety, stress, and quality of life is so much reduced, sleep quality, everything is reduced. So in that, that is one point. And another point is that annually in India, there are thousands of talented young music students graduating out of the reputed universities in India. And most of them, after graduation, they go into private music tutoring. Very, very small number of people go into academics, PhD, or teaching professions. Why can't we make use of them? And if we could make use that thousands of music students, young talented students, and collaborate them into helping all these thousands and 10,000s of patients, that would be great. Now, Oncology in Strings is a lecture concert, first ever lecture concert series I have founded to advocate about instrumental music therapy. So I give a talk and then I demonstrate with the veena. And it was started at the Stanford University campus, and in India I got an opportunity to launch it at Manipal University, which is also my alma mater. So in 11 months I covered 2 continents, 6 cities, 7 sessions, and 1 TEDx talk. And lately I have started lending free, absolutely free of cost, MP3 classical instrumental clips played by me in the veena. to patients, palliative care centers, and NGOs. I would like to thank Dr. Naveen sir, Dr. Sushma ma'am, and Dr. Sankhamitra ma'am for this amazing opportunity. And before I close, I will play a 1-minute piece in Bihar. Thank you so much. And if possible, please close your eyes. Very much.
Thank you, Dr. Tara, for that excellent performance. In fact, it's the second time I'm seeing you in last 3 months. First time I saw you. And what made you to take this specialty from medical field? Will you please share with us?
Yeah, sure. So there are 2 things. First, as a child, I was a performing artist, and I first gave my performance at the age of, I think, 9 or 10. And ever since, I've been playing for the elitist audiences who used to, look into the musical grammar and everything. But I think when I started medical school, I gave a break to music. And one of those days, I think finally, I still had the instrument in my room, but never played. And one of those days, I think I clearly remember, it was an OBGYN rotation, back-to-back patients. I don't know what happened, it was major physician burnout. I came back to my hostel room and I was crying. I don't know what, so I used to have like these back-to-back patients, no sleep, no food. I think I was exhausted and stressed. I started crying. And then I saw this instrument. After so many years, I took it in my hand and played for 15 minutes. I don't know what happened to me. It was like a lot of dark clouds were there and it just faded away and changed into a clear sky. I couldn't explain what it was. Then I looked into what exactly is music therapy, and then I was shocked. To my surprise, there are actually labs at Harvard. They study only about music therapy, and music therapy in musicians and music therapy in other people who are not trained in music, and that was fantastic. And then when I went to Harvard for elective rotation, my mentor, the advisory dean of Harvard Medical School, he told me, Tara, since you are a professional in music and you're aiming to be an oncologist, why don't you collaborate both? And he introduced me to a very famous music therapist, and that was the day I realized about, okay, I have to do something and not just play for the elitist audiences. Yes, that was one thing. That's my personal experience. Another one is I was always inclined to oncology. First, because my grandmother died of cancer in front of me, and secondly, Emperor of All Maladies, a book on the biography of cancer. And I have been always rotating in oncology as a second year medical student, researchers in oncology, and that gave me exposure to cancer patients. Then I saw their stress, then I saw their pain, then I saw their agony. And in the rotations I did in the United States as well, I understood it is the same case everywhere. It's a global thing. And then one of my patients in the US, I said I'm a musician. She was like, I want to see I want to listen to the instrument. Then I gave her a clip and she was like, wow, that's fascinating. So these are two things I was like, okay, Veena has opportunities not only in India, in a global scale, people are accepting it and it is helping people, then why not? So I did this oncology and strings at Stanford campus, and I invited a couple of the oncologists I worked with and my friends. One of them was Ariadne Joseph. She is a Hollywood actress, and she came in with her family. So after the concert, everybody left, and she was staying there and trying to play the instrument. She's an American. She has never seen this instrument, never heard of this instrument before. And after 3 months, I received a text. Tara, I'm buying the Veena. I'm giving an online order. I was like, that was the moment. I was like, okay, I have to take it forward and help and heal people.
Thank you.
Thank you so for the question.
Okay, thanks Sarah. Your beautiful presentation and some sort of out of the way. We liked it very much.
Thanks very much.
Congratulations. But in our institute also, in Cancer Institute, we have an artscape therapy, where the people, the patient, the relative, the doctor, everyone have a get together, and they really music and do the doctor. I'm basically from surgery. I'm getting the surgical department, but this is one of the things we like very much. And moreover, there is hardly any soul in the world who will not like music. Even what they say, if music is a life, please play on. That's what, no? And even you have kirtans or songs to reach God. This is one of the methods of reaching God.
It has a spiritual component.
This is an eye-opening for all of us. Thank you very much.
Thank you so much.
I'm actually looking at I'm a medical scientist, and I'm actually expressive arts therapy facilitator as well. So I've been using expressive arts for quite some time on my patients for supportive therapy, but I've always really confined myself to the mental health scenario. My question to you is, because I keep using dance movement, psychodrama, and a bit of fine arts, I have not explored the music part of it, apart from using it in the background. Okay. My question to you is, have you ever faced that, certain patients might respond to certain specific music or instruments, right? Like now you're playing the Veena. Someone else might prefer the violin, or someone it might be very sensitive.
Right.
So have you faced such challenges?
Yeah, I was on a clinical trial when I was a medical student. It was on head and neck cancer patients, sound in classical music. So most of the patients, it was in Kasturba Medical College, Mangalore, Karnataka. So most patients who come to the clinic probably know only like Kannada, Telugu, etc. And these music we provided were in Telugu or Tamil, etc. Most of the Kannada. So they said, could you give us bhajans or devotional songs? That would be great, like that. So, see, if you're doing a trial or something of that sort, then you cannot give that because you are trying to get the evidence of that particular music. But again, that is what they mentioned in clinical music therapy. There is something called patient-preferred music. So when you are not in trials, but when you are doing it for the patient, for the therapeutic purpose, clinical music therapy, that is what AMP is. Patient-preferred music. Then give the patient-preferred music. No, you can ask them. You can just ask them. Yes, yeah. And then give the preferred music.
Thank you.
Thank you, Dr. Tara.